Joining us now is Dr. Andrew Turchin. Dr. Turchin focuses his work on the integration of aesthetics with the properly functioning bite. His impressive continuing education credits include work with Dr. Ross Nash and the Rosenthal Institute. Dr. Turchin has recently been distinguished as an MDTV Select Dentist under the guidelines of the AMM-RCA. Doctor, welcome to the program.
Thank you for having me, Pat.
So who really is the best candidate for veneers?
Generally anyone who has crooked, chipped, or miscolored teeth. But really, there's only one way to determine if veneers are the right answer for that person. It's to sit down with a doctor and have a consultation. I think every good doctor should spend at least 30 minutes with a patient, and maybe more if it's necessary, to determine what exactly their needs and desires are and how we could help them. Because there are other things besides veneers that might be the right answer for that patient.
Okay. Now, we just saw the level of craftsmanship at the lab. Why is the communication between the dentist and the lab so important for the proper outcome for the patient?
Well, communication is extremely important so that the laboratory can know exactly what we want, because in a way, the dentist is the artist, the engineer, and we've created a blueprint, hopefully, in the mouth with the temporary restorations that will show the laboratory what works in that patient's mouth. Mm-hmm. So if they can't get all of that information by color photos and models, then there's probably going to be not the exact result we want.
Mm-hmm. So what would be the benefit of, say, if you had an in-house ceramist rather than going to an outside lab?
Well, an in-house ceramist can increase that level of communication so much. Some people say a picture's worth 1,000 words. Well, then seeing a person, having that ceramist be able to see that person live is probably priceless.
Because they're right in front of them. They don't have, nothing has to be translated.
Absolutely. And one of the biggest benefits that we have is being able to match really just exactly one or two front teeth. So we found that many people get the cosmetic result they need with just one or two veneers, which is, you know, really against a trend right now we see of 6 to 10 veneers, mm-hmm. which we do plenty, but there's other times where we can be much more conservative with that in-house laboratory.
Okay. So what would you say some of the new materials of the porcelain, any of the newer abilities, how does that translate to more benefits for the patient?
The newer porcelains have increased our ability to create that lifelike restoration, but I still like to give the ceramist the most credit. I've seen even traditional, what we call porcelain fused to metal crowns with metal underneath as a substructure, look completely vibrant with a really, really excellent technician.
So how many visits would be needed? Let's say that you were going to do your upper row of teeth for veneers.
Sure.
What kind of time are you talking about invested?
Well, that varies from doctor to doctor. Anywhere from 2 to 5 visits, I would say. And you'll see a lot of advertisements, a lot of mention about, you know, the 2-visit smile makeover, right. Which sure, we're able to do that, but I like to take a little bit more time with my patients, and it tends to be 5 visits, 2 being the big ones, but those other visits are short visits that really make a huge difference. Mm-hmm. To me, the most important visit is the 3rd visit, where we reevaluate the temporaries and see how they've been functioning, how they look, and if it's exactly what the patient wants. That's where the patient gets to tell me and have their input into the process.
So then the patient's experience with those temporaries will have a dramatic effect on the final results.
Absolutely. That's with the temporaries, we get to test what we considered the right smile for them. They get to go home and live with them. They won't be numb, and they'll get to smile and see what they look like. And function, of course, is really important there, to see if they're speaking and functioning properly.
Now, you have kind of a term you like to use for your belief system. It's the smile fit. What does that mean?
Well, it's a term I coined while studying the integration of health and beauty. Much like the wing of a bird or a petal of a flower, in nature things form and function go hand in hand. They're both beautiful and functional. And really that's what we're looking for in our smiles and our oral health in general. It's much like overall body, how fitness is a higher level than health, where you look better, feel better, and withstand the stress of life better.
Great. Well, let's move on to bridges. Is that something that's still being used, and how would they compare to, say, dentures or implants, things like that?
Bridges are still being used, but more and more in my practice I find that implants are the way to go. With so much research behind implants over the last 25 years, we have a great method to give people their teeth back without stressing the adjacent teeth, which bridges tend to do. But depending on the case, bridges could still be the right answer for certain people. Dentures we try to avoid. I think most people would rather not have something come in and out. So as a temporary solution, sure, but I think the long term, most of my patients choose to have something more permanent.
And as far as teeth whitening goes, light-assisted bleaching has gotten a lot of press lately. How does that compare to the older gel and tray technique?
It's a quicker method. It surely gets a great result, but I always like to give people trays with gel or some other form of maintenance system to maintain it over time, because the last thing I want is a result that's not long-term and maintainable. And that gives us the ability to fight the usual coffee, tea, red wine stains that occur over time.
Yeah. Now, there may be many people who would love to get some kind of a cosmetic procedure done, but they may be under the impression that it's just out of their reach as far as it being expensive or whatever. Is it expensive, and is there financing involved if it is?
No, it's not expensive, but there is financing available. I think any good practice will have financing available for those more extensive cases that might be a little more on the pricey side. But realistically, I think that doing it once right is well worth the investment. Most people that I've seen are just so happy with their investment over time. And what we really don't want is for them to not be happy with the result and have to maybe have it done again. So that's why we take that extra care and time with the temporaries to make sure it's an as-planned result, as opposed to, maybe just putting on the permanents and hoping they look right on the patient.
Sure. Now, the patient-doctor relationship is obviously so important. I mean, you want to like your doctor, you want to feel confident with him. What would you say that a patient should expect from the doctor to build a solid foundation of trust, and what kind of questions should they ask when trying to find the right doctor?
Well, I agree completely that's the most important thing. It really is a relationship. You're gonna get to know the doctor, hopefully, and the doctor really should take the time to get to know you, because it really changes their ability to treat you. And I just personally feel that I could treat somebody better once I know them, because I care about them at that point.
There's a connection.
There's a connection. And so what you would want to ask your doctor is obviously credentials and things like that, and to see past cases to make sure they're the right doctor for you. But it's that conversation that you have in the beginning and throughout. And as long as there's an open communication, I think the relationship is wonderful.
Excellent. Thank you, doctor.
You're welcome.